right, thank you.
All right. Thank you, Allison. And thank you to Delta Omega for doing this webinar series. And thanks to all of you for taking time out of your busy schedules, particularly challenging now given the public health landscape. So I'm going to be talking to you about advocacy and lobbying for public health. My name is Gwyneth Eliasson. I'm an assistant professor in the Department of Health Behavior, Society, and Policy at Rutgers School of Public Health. So since I'm an attorney, this slide is sort of the slide you have to put in, like it's a disclaimer that what I'm going to be talking about is purely for educational and informational purposes, doesn't constitute legal advice. In other words, I'm not your attorney. But if obviously if legal issues come up that are related to what I'm talking about, please reach out. And actually at the end of my presentation, I'll have some resources for technical assistance and other. So I'll be talking to you a little bit about what is lobbying, then what is advocacy, and then sort of advocacy, quote unquote, versus lobbying, with an important consideration, particularly for those of you who are working at, say, nonprofits, community-based organizations, et cetera, which is tax exempt status. And then all wrapping up with some resources for you to develop your skills, learn more, do some more research, whatever it might be that you need to do. So I'm going to actually ask you for word association number one, if you can put in the chat, if you hear the word lobbying or you hear someone say that they're a lobbyist, what do you think of? Who do you think of? And if you just sort of put in the chat sort of what popped into your mind when you hear the words lobbying and lobbyist. Okay, lots of dollar signs. Okay, big corporations, the capital, agenda, big pharma. Okay, politicians, money, business, interest groups, persuasion. Okay. Okay, so yeah, I think you could arguably say that a couple of these connotations are not necessarily so positive. So actually, can I go back? Oh, drat. Okay. Sorry, I am skipping around here and I want to actually go back and it's not letting me. So let me see. It's not a Zoom presentation without some glitches. So what I did, since I'm an attorney, I sort of went to the legal go-to reference, which is Black's Law Dictionary. I'm not going to take the time to read the definitions to you, but notice that the theme is really influence, which several people in the chat, talked about persuasion, etc. So that really is the theme in terms of legally sort of what's considered lobbying. But if you ask Change Lab Solutions, which is a well-known sort of public health and policy think tank based in Oakland, California, they say lobbying has 4 elements. So the first is communication. That can be face-to-face, that can be by email, that can be by Zoom, that can be by fax, which is still a thing, by good old snail mail. And that communication is with a government official or employee, right? So hopefully the policymaker or legislator, but more likely their staffer. And then that communication with that person reflects a point of view. In other words, it's attempting to influence on specific legislation. So in other words, it's a position on, say, a pending bill in Congress, at the State House, at the City Council, wherever it might be. There are multiple types of lobbying. What we often think of as lobbying is legislative, right? You've got a bill pending somewhere. You've got an administrative agency that is issuing a regulation or rule, that is implementing that law. But we also can have lobbying in the executive branch. So in other words, lobbying, say, regarding the White House and the president issuing an executive order. It can be, a regulation that's coming out of the executive branch. Also, it can be money related, what's called procurement. So a request for a contract, a request for proposals for some kind of grant to launch a program, an initiative, a pilot, a demonstration. And then it also can be grassroots, which particularly for those of us in public health, it turns out to be a pretty popular way that those of us in public health, particularly, for example, the APHA, the American Public Health Association, will, do lobbying. So if you're going to kind of look at like what are the ways you can lobby, there's essentially direct, right, which is just what it's saying. It's direct communication. It might be a face-to-face meeting. Obviously, during the pandemic, that turned into Zoom meetings, but it also can be an email. It can be you sign on to a petition. It can be an old-fashioned letter, etc. But ideally, it's a meeting with that policymaker, that legislator, or more likely their staffer. And then there's grassroots, right, which is going to be you're communicating to the public with the view and a call to action. So you're asking the public whether or not they're affiliated with a particular group that's making the call to action to sign on to a petition or to, join some sort of demonstration or to, take some kind of action that the particular organization is asking for people to join in on. So the big distinction in terms of sort of if you're looking at grassroots versus grass tops is it sort of bottom up, bottom up or top down, right? So grassroots is going to be a little bit more top down. You've got the organization reaching out and saying, "Hi, members of our organization, please contact your senator, your assembly person, your council member, whatever, with a particular message." And then grass tops is going to be more that the organization is reaching out to all kinds of leaders, nonprofits, community-based organizations, faith-based organizations, a wide variety to sort of get all of them together and speak with one voice, particularly since many of these smaller organizations often are working with communities that don't necessarily have a voice in the legislative and political process. There are a lot of other lobbying strategies that you can take, not just sort of direct versus indirect, grassroots versus grass tops. There can be coalitions. This is particularly powerful if you are a small nonprofit, a community-based organization, in other words, not something that is well-funded and well-staffed. So there's power in numbers. You can get together with sort of like-minded organizations and associations, or groups that maybe you don't have a lot in common with, but you all are united in terms of having a position on a particular bill or policy that's being proposed. So that can make your voice stronger. Obviously, in this time of social media, a lot of efforts in terms of social media campaigns. For example, right now, Protect Our Care is doing a very active social media campaign around the 16th anniversary of the Affordable Care Act, which was on the 23rd. So just a couple of days ago, and talking about what the effects of HR1, aka the One Big Beautiful Bill Act, aka the Budget Reconciliation Act, in terms of people becoming uninsured who formerly were insured either through the Affordable Care Act marketplace or through Medicaid expansion. So media campaigns, particularly for organizations that don't have, communications people, a big budget and funding, can often be a fairly low cost but very effective way. Obviously, then you are dealing with the issues of misinformation, disinformation, et cetera, but nevertheless, it can be a useful path. And then in the US, particularly, though it's not unique to the US, but arguably pretty influential, is PACs, often through, so donating to candidates through what are called political action committees. So what is a political action committee? It is a private political organization, right? So it's not a public organization. It is not nonprofit. It is not tax exempt. And it has a very specific function. It was basically called into action and organized and funded to either support or oppose something or someone. So it could be a bill that's pending in the legislature. It could be a ballot measure that voters are going to vote on, say in the November elections. It could be a candidate running for office in any level of government, or it could be some other political issue like a referendum. So because it is a private political organization with a very political focus, it has to be registered with the Federal Election Commission because they oversee elections. And then there are different types, which basically depends on connected versus non-connected. Are you giving money because you're sort of connected to a particular organization that has a connection to the committee, or are you sort of doing it on your individual basis, say through your employer? And I should just mention, and this is getting a little bit into the weeds, but just so you know, that essentially if you're dealing with PACs, these three different types of money come up. What are sort of ominously called dark money. Hard's dark because it's essentially a black box. You don't know who donated it. You don't necessarily know how much they donated, but it is spending that is particularly designed to influence the outcome. And sometimes those are dark money is through super PACs, which are essentially, major PACs that are really focused on raising and funding as much money because they actually do not have a cap or a ceiling on how much money that they can be collecting to influence that outcome. So that's dark money. Hard money is essentially what you usually think of as traditional spending. All of that hard money has disclosures. Like you have to know who donated. There are limits to how much you can donate. For example, as a person versus bundling through your job, it has to be sort of coordinated. So those, for example, if you see, television ads or web ads on, this was approved by so-and-so, running for Congress, that'll be an example of hard money. Also political parties. So messages that are sponsored by the Democrats or the Republicans and PACs. And then the third type is soft money, which is sort of outside of political spending. So it's independent, it's not coordinated, it's done by individuals, done by organizations, but doesn't have quite the same sort of focus in terms of being heavily and pretty much solely political. So I'll take a pause here just to see if there are any quick questions or requests for clarification. There will be time at the end, obviously, for further questions from both myself and Olivia, the other speaker. So if you have something that needs immediate clarification, please feel to type it in the chat. Okay, then just in terms of lobbying, again, somewhat unique to the US, because in the US, really lobbying has a very important role in terms of what happens in Congress, what happens at the State House, are what's called K Street firms. And they're named that because they are firms either located on K Street or close to K Street in Washington, D.C. In other words, within easy walking distance of the Capitol of the Hill. So most of these lobbying shops are part of large law firms, but increasingly in the last 10 or 20 years, some have become small boutiques that specialize in particular issues. So it might be a particular industry, like the pharmaceutical industry. It might be a really sort of issue that's important to people, but maybe not tens of millions of people. For example, families with children who are living with rare diseases that require orphan drugs. But if you look at the top 20 of the lobbying firms, it's going to be predominantly large or multinational law firms. In other words, firms that have a global presence. Yes, they're based in the US and New York and elsewhere, but then they'll also be in Europe, they'll be in Asia, throughout the world. So again, they're an important aspect in terms of advocacy and lobbying, particularly lobbying in the US. But I think, my major message of today is public health historically has not been comfortable with lobbying. And there's a lot of reasons why, which we don't have time to get into. But as you can see, public health is woefully underspending. And I would argue that given the current federal, state, and local government environment, we need to get more comfortable with lobbying. And if we can't devote a significant amount of money to it, which we might not be able to, hopefully we can donate some hours because we're more comfortable with the concepts of what is advocacy versus what is lobbying. But as you can see from this graph, on the far left, you've got pharma, the lobbying organization for big pharma, spending 30 million. And you've got count them three major public health organizations, in other words, NACCHO, ASPPH, and APHA, in order from who spent the most to the least, but all together spending under $500,000. So, obviously, public health is not going to be able to get anywhere near pharma money, let alone hospital association money or American Medical Association money. But nevertheless, we should be getting a little bit more comfortable with what lobbying is and isn't as we move forward. So what exactly is a lobbyist? And this is a definition from the National Conference of State Legislatures. So again, this emphasis on influencing, and then specifically saying that if you're a lobbyist, you are lobbying on behalf of another person for money. In other words, it's not a volunteer gig, but you're not simply engaged in lobbying, because there are a lot of jobs where lobbying is probably part of your work. For example, if you're a legislator or a policymaker, and you are sponsoring or co-sponsoring a bill, you are essentially lobbying your fellow legislators, in your party on the other side of the aisle, in terms of potentially co-sponsoring the bill or, voting on it when it gets to the floor. That's technically lobbying, but you're not a lobbyist. You're just doing this lobbying, this influencing as part of your day job as a legislator or policymaker. But if you are a lobbyist in the sort of traditional sense of you are lobbying on behalf of another organization, group, whatever it might be, and you're being paid to do so, once that classification is triggered, that leads to a lot of things that you have to comply with. So you might have to register as a lobbyist. There are certain disclosures you'd have to make, gift restrictions, for example, maybe you can take gifts that are, $10 or less, a pen, for example, and then certain things you can't do. Like, for example, you maybe cannot go to a steakhouse for a $500 dinner. However, this really varies by state. So this is why if you are a small business, a community-based organization, a nonprofit, you probably are going to want to reach out for a little bit of legal advice, because it really does vary by state, with some states having very broad definitions. For example, in New York, which is where I'm from, there are about 18 or so exceptions to what isn't a lobbyist. For example, being an attorney is not a lobbyist, even though you could argue that certain things that are legal tasks are kind of lobbying, but nevertheless, you're doing them as an attorney, not as a lobbyist. So again, you'd want to know your state jurisdiction, the particular state law for your jurisdiction. So that's sort of lobbying in a nutshell. What about advocacy and advocates? So again, word association, I'm going to ask you to put in the chat. If you hear the word advocacy or someone says they're an advocate, what do you think of? Who do you think of? Okay, lobbying, but less money. Okay. Anybody else? Protecting the vulnerable. Okay. Grassroots. Nice. Champion for a cause. Okay. Activism, educating. Hi, Mitch. People who educate legislators on issues, but not, yeah. Okay. Education. Okay. Yeah. Yeah. So that's really your, and notice that these are much more positive, right? So this is where Black's Law Dictionary really lets me down, which because it basically says, advocacy is being an advocate. I'm like, okay, thank you. So it turns out the IRS is somewhat in the slide or two. We'll see why. But again, it really is more about the informing and educating as opposed to influencing. So this is kind of the nutshell. I mean, if there's anything else, nothing else that you get away from my presentation is the whole, advocacy, quote unquote, versus. So all lobbying is advocacy, but not all advocacy is lobbying. So advocacy really is educating or informing, whereas lobbying is influencing. And if you ever want a refresher, there's this nice, 2-minute video done by Policy Takeover that talks about the difference with the emphasis on the tax consequences. And again, this is a nice graphic from NACCHO, sort of the idea that the overall umbrella is education. But then within that, you can have advocacy, which is sort of more focused, more directed. And then under that, you have lobbying, which is heavily emphasizing influencing, having a particular bill, having a particular rule, having a particular regulation in mind, having a position on it, supporting it, not supporting it, wanting to amend it, etc. And then, really lobbying to try to make that position happen. Happily, there are lots of things you can be useful for those of us in academia, also can be useful for those of us who are, working in community-based organizations, small nonprofits, etc., public health departments, etc. So, building up a coalition, reaching out to other organizations, that's not lobbying. Educational campaigns, right? Infographic and know your rights, an explainer, also not. Sharing best practices, evidence-based policy approaches, doing analysis, study, and research that generates lessons learned, a white paper, etc., all not lobbying. And then the big one, particularly for those of us in academia and for those of us who are subject experts in nonprofits, community-based organizations, public health departments, is presentation or testimony in response to a written request. So for example, right says, dear so-and-so, as the head of this particular section of the public health department, we would like you to appear before us for this hearing. And if you're unable to appear, please submit some written testimony. So that request, that request for essentially you're sharing your expertise, that is not lobbying, right? Because you're not showing up and saying, I support this bill, I don't support this bill. The committee in whatever federal, state, or local government that is asking you for is asking sort of for your informed, educated opinion on the area, not on a particular piece of legislation. So again, another thing that's important to know if you are a CBO or a nonprofit or in other different organizations or associations is what kind of tax exempt organization am I? And this is again from the Internal Revenue Service. So there actually are more than 30 of these. So this is referring to the Internal Revenue Code, Section 501. So there's actually about 30 Cs, different types of organizations. But for purposes of today, the two most common are C3s and C4s. So C3s are charitable organizations, kind of a misleading name. Doesn't really mean like they're giving out charity, like they're a religious organization giving out alms. But anyway, But what's important for these two is the issue is one is tax deductions and two is lobbying. So C3s, if you donate to a C3, that donation is tax deductible. So for example, you donate to APHA, you will get a little confirmation from them. Thank you for your donation. This is tax deductible and please hold on to this letter for your tax return. However, the flip side is limited lobbying activities, and you cannot do anything regarding political campaigns. So people who are running for office, if you're a C3, you're not touching that. So two big examples are actually APHA, the American Public Health Association, and Delta Omega, so this organization running this series. The other pretty popular one is C4s. These are called social welfare organizations. Again, kind of a misnomer. They're not really necessarily welfare in the usual sense of it, but again, variation in terms of tax deductions and lobbying. So contributions are not tax deductible. So when you donate to them, you will not get a letter saying, hold on to this for your tax return. However, the flip side of that is you are allowed political campaign activities, as long as it's not the sole focus. Because remember, it's really generated to be pouring a lot of funding into a political focus. So in other words, a C4 most likely is going to have a lobbying arm, but its focus isn't going to be on lobbying 24/7. So two examples that, what you could argue are very wide variants along the political spectrum are the NRA, the National Rifle Association, and the ACLU, the American Civil Liberties Union. And then I just like this graphic because it gets a little bit more specific in terms of activities that are really unlikely to be considered, lobbying and generate any considerations in terms of your organization's tax exempt status. And then things that might be a little bit trickier, engaging in politics, lobbying, there may be issues in terms of how much hours, how much money, et cetera, that you spend on lobbying, depending on what kind of organization you are. Though this particular graphic is focused on, C3s, which probably many of you on the call, if you're at a nonprofit, a community-based organization, an NGO, non-governmental organization, that's probably a C3. But nevertheless, this is probably where, if you have any questions, you might want to reach out for some assistance. And then just a reminder that this is sort of within the overall landscape of all the different ways that you can quote unquote advocate, right? Going from sort of the bottom of the sort, which is education, all the way to sort of the most challenging at the top, which is litigation. And although I'm an attorney, my first thought isn't always, oh, let's go to court, right? It's like, let's do some other things before, maybe then eventually I'll get to court, but it's not my first choice. So just a reminder that, we in public health and elsewhere have a whole variety of strategies that we can use within the sort of overall umbrella of advocacy. But hopefully, between this webinar and the resources I'm about to share, you'll be much more comfortable with potentially engaging in some activities that might seem like lobbying. So if you want to develop some skills, I have a couple of suggested resources. There's a free self-paced course through Columbia. There are a couple of books that were published by APHA Press, including Policy Engagement, which really has the nuts and bolts of lobbying, advocacy, educating, et cetera. Bunch of resources on advocacy, including the NACCHO Advocacy Toolkit, which is really focused on Congress in terms of what are important committees, congressional calendars, et cetera. And then if you want sort of an overall view, because this today is very focused on public health advocacy, there's a professional development webinar from last year. Additionally, if you want to know more about lobbying, here are some resources. Change Lab Solutions, which is an expert. You can look up your particular state in terms of how it defines lobbying, and then Open Secrets and Revolving Door in terms of who are they lobbying for, how much money they're making for it, and from all of that. So feel free to reach out to me if you have any questions following up. And I will turn it over to Olivia for a real world example, and then look forward to our conversation and discussion at the end of the presentation.
Thanks, Gwyneth. My name is Olivia Zarella, and I am from the Colorado School of Public Health. I am actually presenting today on my own personal behalf. The work that I talk about today is specifically work that I did on my own. Please give me a quick second while I figure out how to share my screen these days. Love that for me. 1 second. All right. See. Can you see the whole thing or just my slides.
You're kind of you're sort of in presentation mode. So there's like the slide on one side and then your notes on the other,
Oh, so you can see the
and then
whole
your
thing.
slide deck at the bottom.
Okay, one second. I don't know why it's doing that.
Because it's a Zoom presentation and things always go wrong. I
They
mean,
always go wrong.
yeah.
That's it.
Yeah, unfortunately, I can't see my notes, but geez, it would be awesome if I had learned how to do things, huh? Um,
Also, we see your notes. I mean, that's whatever's works for you, Olivia, frankly.
okay. I'm almost there. I think I got it here. Thank you for your patience. And a doctorate degree does not teach you how to use the computer. So that is the fun part here. All right. Let's see. Okay. All right. So I am going to be talking about public health, building a public health advocacy narrative. And I just want to double check again that you can see my slides at this point.
Yes.
Okay, fantastic. Thank you for your patience with me and everyone. My name is Olivia Zarella. I have a doctorate in public health and a master's in public health, and I don't know how to use Zoom apparently after all these years. I am at the Colorado School of Public Health. As I mentioned, the work that I am talking about today is on my personal behalf. It was work that I did separately from my position and is not on behalf of the University of Colorado. I'm going to be talking a little bit about advocacy and lobbying and giving a real world example. So thank you for Delta Omega for having me, and thank you for Gwyneth for giving such a fantastic introduction to the concepts that I'll be talking about today. So the things we're going to be covering today, I'm going to briefly walk you through the following information, as well as we'll have some time for questions at the end. So we're going to start with the basics, defining advocacy versus lobbying, because the distinction actually matters enormously. And because that distinction, yes, it matters. So, and how I structured this campaign, and then I'll walk you through building the campaign itself, how it came together, the outcomes of the campaign, and then we'll close with some lessons learned. So, advocacy is a broad promotion of a cause or idea, while lobbying is a specific type of advocacy designed to influence specific legislation. And so for advocacy, before we get into the campaign, I want to make sure that we're using these terms, the correct way. It's broad advocacy. It's everything you do to raise awareness, shape public opinion, and educate your audiences about an issue. So whether we're talking about social media campaigns, public education campaigns, coalition building, earned media and research dissemination, as well as getting the community mobilized behind your idea and what you're trying to advocate for. You're not asking anyone specifically to vote in a certain way. You're building the conditions for change and you're starting the conversation. That might end up leading to lobbying. And lobbying is specific. It's that direct contact with legislators or their staff to influence a specific piece of legislation or policy decision. It involves meeting with representatives, testimony at hearings, submitting formal comments, delivering one-pagers to offices, and requesting specific advocacy support. In the campaign that I'll be talking about today, the Save NIOSH mining campaign that I was involved in, we deliberately ran both tracks. Sometimes we set separate lanes, and at times those overlap depending on who was involved. But we maximized our reach by including both public awareness and directive legislative pressure. So let's set the stage a little bit here. I want to give you all a little bit of background about me. My background is actually in infectious disease epi. I ended up getting into strategic communication and then in health policy this last few years. However, I entered into this work on my own without knowing anything about mining. So my point of talking to you today is that if you know the things that you need to put together to make this calculation of like strategic communication and advocacy and lobbying, you can probably advocate or lobby for something that you may not consider yourself an expert in. It's about really understanding what it takes to understand your audience, change mindset or educate and kind of get the purpose across to those individuals. So mining is one of the most dangerous occupations in the United States. Without what we call the National Institute for Occupational Safety and Health, companies and communities would pay the price through preventable injuries, fatalities, and equipment failure. And in the United States, we have about 324,000 miners. That's minimum. There's a lot more, and about nearly 13,000 mining operations. In 2023, about 40 miners died on the job, and there was over 3,600 non-fatal injuries reported that year. But the good news is that this is actually improved. In 1984, about 206 miners died on the job, and that count has dropped every year with some slight fluctuations. But we can really equate the reduction to fatalities to a lot of things, including the creation of the NIOSH mining program between 1996 and 1997. And then some additional information for you. The average cost of a single mining fatality is $1.34 million, and that was in 2025. About $2.35 billion of workers' compensation claims cost the United States because of mining injuries. And then 3 to 5 times indirect costs beyond that include loss in productivity, overtime, damaged equipment. And so it was something that I had to make very clear in the early onset, and we'll talk about how this all came together, but NIOSH mining and NIOSH itself is not OSHA. And so there's a very clear distinction that needs to be made in this campaign, and we'll talk about what the campaign was. But some things that I realized pretty early on was that we need to make it very crystal clear that NIOSH is not a regulatory agency. Regulatory kind of federal agencies tend to not really fit across aisles. It's not really a bipartisan support topic. And they develop science, NIOSH develops science, guidelines, technology that makes standards possible. So gutting NIOSH mining doesn't come at costing jobs. It eliminates the pipeline of research, and it keeps miners alive for decades to come. And second, mining is one of the most dangerous occupations, as I mentioned, and it's also an economic powerhouse in the country. And then third, there are offices across the United States at NIOSH that have specialized research teams that focus on different kind of improvements to support miner safety and health across the country. So why am I talking about all of this? Well, in February 26, 2025, last year, a lot of things happened. So I just want to kind of remind you, the Office of Management and Budget, as well as the Office of Personnel Management, issued some memos basically saying we are going to reorganize our federal agencies, and these are our plans. In March, DOJ laid off the CDC's mining safety division. Some of the Spokane, Washington staff were affected. And in April 1st, the worst day to possibly do this, on April 1st, 2,400 CDC staff received RIF notices, so reduction in force notices. And NIOSH is a part of the CDC. It is under HHS. And that included most of NIOSH, as well as NIOSH mining program staff in Spokane, Washington, and Pittsburgh, Pennsylvania. Shortly after that, I was contacted by a project partner who sat on the Mine Safety and Health Research Advisory Committee, which is a committee that advises the NIOSH mining program. It's a committee made up of external partners, and they had a good partnership with the NIOSH mining program. This individual reached out to me knowing I had a background in strategic communications, and basically mentioned we need to do something to support these federal workers and advocate for them to get back to work. Because if you can remember, in 2025, there was a mass campaign that basically wrote off federal health workers and federal workers as a waste to our system. And it's not always very clear about the processes behind the scenes and what federal workers do, especially in health. And so there needed to be a massive campaign to kind of remedy that and make it clear to the general public and our politicians that these individuals are incredibly important to our workforce and our health and safety, not only in mining, but across many different agencies and occupations. In May, the Save NIOSH mining campaign launched, which included a strategic plan, a coalition of individuals, which we called the Friends of MSHRAC. and products, media, and lobbying outreach began. And as I said, the MSHRAC is that Mine Safety and Health Research Advisory Committee, and we'll talk about why we created the Friends of MSHRAC. So there you go. Why the Friends of MSHRAC? We basically had a group of individuals that came together. There were partners of the mining agency, potentially were in MSHRAC themselves. Some of those individuals were RIFT employees from NIOSH Mining, and they had come together in a group and invited me one day to a meeting. And it just took off from there about kind of how do we make a legitimate terminology and coalition and name this group in order to not only have a legitimate, sign off for any kind of campaign, but also to make sure that this coalition and this identity wasn't tied to any individual, because at this point, a lot of the RIFT employees were concerned, if it comes out that my name is involved in this, then I potentially will be on the chopping block even further. And so it wasn't accidental. These are the individuals that I mentioned that were involved in MSHRAC. And it really was an incredible situation that we kind of realized that meeting on a weekly basis, we could put all our brains together and all our partners and coalition and connections together to create this campaign. So once the coalition was put in place, we needed a strategic communications plan. And so let me walk you through the next 5 steps. So step 1 was defining our goal and our audience. The goal was simple. And specific. So return NIOSH mining employees to work, reverse the rifts. And the work specifically, these individuals worked in Spokane, Washington, and Pittsburgh, Pennsylvania. The goal wasn't just to raise awareness, but to bring them back to work. And that specifically shaped every decision we made. Our audiences were to the general public and politicians with the political power to act. So framing the message for them was important because we knew we couldn't just say these researchers are important. We had to connect to what our audiences cared about, which was mining safety, economic impact, and jobs in their districts. And mining safety seems a little bit abstract to the general public, but it depends on where you campaign. And if you're campaigning to areas where mining is a major economic source for families, then mining safety really does actually resonate with those families. And then step 3 was gathering data, and this was a team effort. So coalition partners collated state-level mining data, number of mines, type, operators, and employees from mining and across 24 states, actually all of the states, but we pulled 24 states specifically. And that data became the foundation of our most powerful products. Steps 4 and 5 were building and distributing these products, which I'll walk through in the next few slides. So the campaign products that I built for MSHRAC and for the Friends of MSHRAC included social media work centered around 3 LinkedIn graphics. We decided LinkedIn because our population of interest was getting other researchers, organizations, people that are connected, mining operators, mining companies to be interested in this because it inevitably will impact them. And so we chose LinkedIn instead of like Instagram or Facebook. We designed 3 types of social media posts. The goal of each graphic was to first catch your interest and then also keep your interest, as well as really make you want to know more about this and potentially share it with your networks. And so each of the graphics came with a caption and explicit instructions on how to post it. We lowered every possible barrier for partners who wanted to share. We don't want to make it time consuming. We just want to give them the things that they need to post and the option to post it, and then hopefully they would. We also built multiple email templates. One of them was first of an outreach awareness, so a shareable email to send to network, calling for the amplification of the campaign. The second was a warm introduction template that partners could use to connect their contacts with us or myself, who was kind of running the email behind the scenes. And both emails came with a call your rep template as an attachment, a step-by-step guide for constituents who actually contact their representatives and senators. And that template was, critical for converting awareness to action. We also made a one-pager. I would argue that this was one of the most important products we built, and the state-specific versions, which we will get into. The one that we created for the national version summarized the NIOSH mining value. It was designed to be left in congressional offices on the lobbying side, or shared by email with those offices. So it's basically like a one-stop document for anyone who needed to understand the issue quickly. And then we started to think, it would be more impactful to have state-specific flyers. And so we made 24 state-specific one-page flyers. The reason for these 24 states was the states with the most economic GDP impact from their mining organizations and the ones that are known for the most mining or mining operations, as well as we really wanted to hit those Republican states. And this is not a political, aspect or argument. It's just that the Republican side of the aisle basically runs the House and the Senate, and they are major, they have a major control and power. And so getting that kind of side of the aisle to get involved was just one of our goals. And in order to do that, we started to make some specific state flyers. And what we did was we changed very small parts of the one-pager national version to have statistics that actually were more specific for the state at hand, because a senator from Wyoming does not want to hear a national statistic. They may want to know more what it means for Wyoming. And honestly, the moment that you localize your data, the conversation changes from this is a public health issue to this is your constituents' issue. And so that's very impactful for lobbying. There's some other things we created. There was a listserv of over 1,500 contacts that we would share our updates with on a pretty much monthly basis, as well as a call your rep template, which I talked about. So we've talked about public advocacy, the LinkedIn graphics, the media outreach to mining and occupational health press. This is one aspect that we did almost on a daily basis. I would send emails out to major media organizations, which I will get into. And we're not just talking national organizations, because your local media is one of the strongest ways to get the general public involved, especially in those states like West Virginia that has a major mining operations, and in Washington and in Pennsylvania that were impacted by the loss of employment at NIOSH. And the direct lobbying, we had dozens of society and association meetings led by societies that were our partners through the Friends of MSHRAC, those that were personally going to be impacted by safety challenges in miners. And they have their own lobbying groups. They have that power. So they were able to hold these meetings and make contacts with representative offices and senator offices to really kind of bring that advocacy into real world change. And that direct lobbying started to occur. All right. So media coverage that resulted was a ton. This is just a small amount to show you. I know we're limited on time, but there was major features in Bloomberg, CNN, Reuters, Politico, The Scientist, and then some more specific ones that would actually reach the mining organizations that had that political power and lobbying impact, like Mining Engineering Magazine and Coal Age. And then also, and like I said, you don't want to forget your local media. They are one of the most important organizations that you can think of. And also a lot of those local media organizations will pick up a story, and then a national media organization will see that story and republish it. So forgetting those is a major thing that you don't want to do that. You want to remember that your local media has a lot of power on the ground. One of the coolest things was seeing actual change from these legislative meetings that were being held. And I'm going to play a quick video, which is going to, of course, change my ability to show you guys things. So please, hopefully you can hear this. Let's see, play from current slide. Thank you for your patience as I mess with this whole thing, but let's play. Come on. How do you play? Maybe I won't play it, but let's see. Action. All right, so I'm not going to play it, but I wish I could, but thank you for your patience as I go through all of this. So this is Senator Rounds from Montana, and he ended up questioning RFK Jr. at a Senate committee meeting in May of 2025. And it was very cool because it was a direct result of our meetings that we had, the advocacy, and then to the lobbying. And this really got a lot of media outlet support. And it was also really kind of broke through those partisan lines. We had a lot of Democratic support for NIOSH, but seeing a Republican senator who's on the appropriations committee, asking RFK Jr. why NIOSH mining individuals had been riffed and not been brought back, especially after there seemed to be support for mining safety across partisan lines. So seeing that actually occur was an incredible experience for me and for the Friends of MSTRAC and for, I think, a lot of RIFT employees. And it's just a clear example of what you can do through advocacy. So one of the coolest things, on January 13th in 2026, the NIOSH rifts were reversed. It was not just NIOSH mining, thankfully, it was all of the NIOSH employees that were originally riffed in 2025 were brought back to work. And for me, this is just proof of something more fundamental, that public health professionals who understand how to communicate, how to build those coalitions, how to run a dual track advocacy strategy can really move the needle on federal policy, if not local and state policy, even in what I would consider this last year a hostile political environment. And this was just an incredible experience and just very exciting. And I just want to thank, it wasn't just us, it was multiple organizations like AIHA that was doing a massive campaign. It was just a huge amount of people coming together to make this possible. So let me distill what I think some of the 6 most transferable lessons from this campaign. So 1, coalition really equals credibility. Take a quick sip of water. A named coalition gives you legitimacy. So for the Friends of MSTRAC, it protected individuals, it unified our voice, it was a sign-off. I could reach out on behalf of the Friends of MSTRAC when I was reaching out to partners. And I would recommend you to think critically and carefully about what you name your coalition and who it signals you are, because the people we were reaching out to knew what MSTRAC was in a lot of cases, maybe not the political lobbying side, but that usually was explained in the forefront of our messaging. For number 2, you need to know your audience's interests. So we didn't just say miners are in danger. We said this is going to impact your state's GDP based on this research. You got to find the frame that meets your audience where they already are. And sometimes in public health, that can feel a little morally inept because we want to immediately talk about, these are people's lives. This is fatalities. This is an issue this is a moral issue, but really sometimes that isn't what talks to the people that you need to talk to. And that's not really what speaks to them. And so including, economic impact is a really motivating statistic or type of statistic. For 3, localizing the data. So we use 24 state-specific one-pagers. If you want a legislator to act, you have to show them what the issue means in their state and for their district. 4, keeping advocacy and lobbying in separate lanes. I would argue that, keeping those distinct tracks can protect participants. I would ask people what they were comfortable in doing. I never specifically was involved in the lobbying. I just kind of directed the advocacy and gave the information to those that did lobby. But sometimes those overlap and it just depends on who's actually comfortable doing what. 5, so earning media, support amplifies everything. So Bloomberg and CNN coverage didn't just inform, it created urgency and gave the lobbyists that were going ahead with this message something to point to in every meeting. So local media is a huge partner. And so you do not want to forget them, like I said. Those are the individuals that get to the audiences on the ground and, really also motivates local advocacy as well. So there's a lot of different things that may have sparked up from this. And then 6, this is a more personal one, but show up before you have a plan. I said yes to supporting this coalition before I knew what the campaign was, before I knew about miner safety. Like I said, my background is in infectious disease. So the relationships and the responsiveness really kind of created the opportunity, and just kind of, you'll learn as you go. Just know kind of the formula that's necessary for advocacy, and that'll kind of get you to the end here. So these are the 6 steps: identify, frame, coalesce, produce, amplify, and lobby. These are the steps that I would recommend you consider and follow as that formula that I mentioned. I'm not going to get into each of them, but I think that they are really kind of the baseline to follow and the foundation for advocacy. So I'll close with this. Public health needs more advocates. It's not necessarily about increasing our lobbyists, not necessarily more researchers. We just need people who can translate the science into stories. that move people, that build those coalitions, like I mentioned. And you don't need a large famous platform. You need to be able to bring partners together, kind of bring all their messaging and kind of get everyone in the room to agree upon something. That's really the advocacy aspect. It's a lot of meeting organization and translation of something that factual information that may not resonate with the general audience, thinking about how to get that across. And you need a clear story and with people willing to support and help. The three things I'd say for you to take away is start with those relationships, frame your audience's interests, and then use both advocacy and lobbying to get across your message and deliver the ask to the people that actually can make change. And I just wanted to say thank you so much for having me, and thanks for your patience as I've tried to remember how to use Zoom.
All right, you did great. Thank you, Olivia and Gwyneth.
Hopefully I didn't go out too much because of my Wi-Fi. Hopefully it was okay.
No, your Wi-Fi was great. Okay, so let's go ahead and take some questions. Everybody can either put them in the Q&A in the chat. We can see both. So the question just popped up. How was the transition from diseases advocacy different than minor safety? So Olivia, I think that's for you.
Yeah, it's a great question. I have done advocacy on the infectious disease side, especially since COVID. I don't think it actually changed that much for me. And it's because the formula itself is you need to resonate with your audience and specifically take information that maybe researchers that we kind of have siloed ourselves into and, talk amongst ourselves with the data and the statistics and be able to translate that to the general audience. And so for me, I took that same formula, applied it to mining. It took a little bit of time for me to kind of understand the statistics and science in mining and the terminology and the people involved. And then once you understand that background, actually being able to, like I said, translate it and find what's actually going to resonate with the audience at hand. And so my point of bringing up that infectious disease aspect is just to show that if you understand the formula behind advocacy and then potentially lobbying, you could probably do it with most different types of topics. It's really just understanding who you're talking to and how to translate that information.
And I just want to revisit a question that was in the chat, which was, can you be both a 501c3 and a 501c4? And the answer is yes, but they have to be separate and distinct. So as it turns out, actually, the ACLU is an example of that, right? There's the ACLU organization, and then there's the foundation. The NRA, the National Rifle Association, is also an example. So there's the NRA and its foundation, and also the Sierra Club, so environmental. So you can be, but in other words, it has to be a separate, distinct organization that is doing the lobbying as a C4.
Okay, so I have a question, and hopefully we can answer this in the next couple minutes. So I do some other work related to policy, advocacy, lobbying, and have found that there's just inherent reticence, among public health professionals to get in that territory. You're really putting yourself out there. It's playing the long game. And part of, my thought is part of it's because most things that we do in public health have a job, epidemiology or, health services administration. There are very few people. There are some people call themselves lobbyists, but not a lot of public health people call themselves lobbyists. There's also not a title for advocacy, occasionally advocacy director, but you don't see that much. So I think my question is, who should be doing this? How do we get the public health profession to lean in so that we all feel like we've got to be involved in policy changes, basically?
So I think public health, with its background in social justice, which resonates with me because my background is as a social justice attorney representing low-income New Yorkers before I went and got my MPH and then went into teaching, is, I think everyone in public health, no matter whether you're quantitative, qualitative, in health systems and policy as I am, you are an advocate. And advocacy is such a broad umbrella. It can include informing, it can include educating, but it can include lobbying. So hopefully between this resource today, last year's professional development resource, as well as some of the things I shared in the slides deck, people will be more comfortable with it and there'll be less of an ick factor. So
I would agree. I also am not somebody that got a degree in health policy. I'm not somebody that has ever worked as a lobbyist. I've been to Washington, D.C. to do advocacy multiple times on behalf of APHA and then some occupational health organizations and met with offices. The biggest thing I learned every single time was crafting your message. Understanding, obviously, there are norms and there is decorum that you have to follow when you're doing those things, but being able to get ahead of others that go in without realizing that the statistics they're talking about, the information they're providing is just jargon and is going to go way above someone's head. And so these individuals, when you do have those conversations, they have limited time, they have a billion other meetings to have. And so really just figuring out how to silo the information down to make it clear to who you're talking to and why would they be interested. And that's been the biggest thing for me. And if we can just start really pushing in public health, especially public health education, about communication and the importance of communications in public health, how to represent yourself, how to answer media, how to speak with partners, how to be comfortable taking difficult questions. Like those are the leadership things that we need to focus on. And that, in my opinion, is really how we kind of break into the space. I don't think technically we need to be a lobbyist, but I do think in order to be taken seriously, we need to be able to learn how to communicate these difficult jargon heavy terminologies and the things that we really keep to ourselves. And so to unsilo science in a way.
yeah, language
Fantastic.
matters. Language matters. And like even Olivia's example, I mean, of, you're not necessarily going to be just focusing on minor safety, although that's hugely important. People are important, but you're also going to have to talk about sort of policymaker, what's important to them, which is GDP, right? And so I think that's the one thing with public health is we are going to have to be more savvy about our audience. If you talk to a lot of people about social determinants of health, most people are going to be like, huh? So know your audience.
Well, that's a great takeaway from the presentation. So we're out of time, but this has been fantastic for those of you that are on. Yes, we can share slides. We will have a recording up probably within about 24 hours. And I just want to say a huge, huge, huge thank you to both of our presenters. So happy you could be with us today. And hopefully you all will be able to join our next presentation on communications on April 28th. All right, and we will see you all then.
Thanks so much
Thank
for having
you.
us. Thank you,
Thanks for
everyone.
having us.
Bye-bye.